The athletes that we serve with Special Olympics, they don't have the same access that a lot of us have to healthcare, and they have different conditions that most of us don't deal with. And there's not practitioners, whether they're doctors, physical therapists, or other health providers, that are accessible in the communities and to treat them and help them improve. So these screening events really help them, one, get access to screenings real time while they're on site participating in our sports events, but more importantly, we can connect them back, hopefully when they get home, to a physician or a therapist or a healthcare provider that can help them.
I think the most important thing about these screenings is that we are giving services to people who don't necessarily get the services. Being able to train students in order to feel comfortable with working with people with special needs, I think is so important.
It's a privilege to be here. I feel as though having that opportunity to meet people who are unique, they're diverse. And this is an organization that is founded on inclusivity and unity.
Just to have these people who give their time and their expertise to help out the athletes, I think is wonderful. And that's why I started many years ago, because they need the care that everyone else needs.
What was different for me was serving patients in private practice. There's kind of a predictable conversation and routine. When I'm here, I get hugs, and I see athletes who I know from back in Palm Beach County. That for me is great. I love to see them smile, because that's our ultimate goal. When they come back, to see that they've made improvements.
It makes me a better clinician because they are more challenging. It makes me work harder, it makes my skills better, because they can't respond the same way that everyone else. So it pushes you to do more and to think outside the box.
One of the hesitations of most volunteers is, I'm gonna, how much time is it gonna take? How much am I gonna have to prepare, and how much I'm gonna do it after? They're very organized. They really make it easy for you to learn and grow and do this.
Working with individuals with special needs is probably the most fulfilling part of my job, so I love it. I've loved it since I started with Special Olympics Healthy Hearing in 2006. I just feel that if you need gratitude in your life and gratitude in your job, that this is probably the best place to get the gratitude.
It's wonderful to give back and to help them see the way that they should be able to see. They should get the same care as everyone else, and that's why I do it, and that's why everyone else here does it as well. We want to help.